Recording in progress.
Hello, everybody. Welcome back to season 4 of School of Speech. Oh my gosh, I am so excited y'all are here. School of Speech is presented by SpeechTherapyPD. All right, quick question, y'all. Have you ever looked at a high school caseload and thought, oh my gosh, this is totally a different job than an elementary school, right? Well, I know. Like the goals feel bigger, the stakes are higher, and suddenly you're not just working on classroom success, you're thinking about adulthood, employment, college, like all of it, right? Well, you will be so glad you're here today if you're going, what? I'm in high school now. Because today's episode is all about what SLPs need for the high school setting, how we can empower our teens and young adults academically, socially, well beyond graduation, right? Okay. So again, season 4 of School of Speech. I'm so excited. I love that this is going on and love it so much. This podcast was designed and still remains dedicated to the school-based clinician. This is your space to learn, hopefully to laugh. I think I'm funny, and to lead with purpose. I'm your host. I'm Carolyn Dolby, and today we are empowering teens on what's next. The high school SLP's role in academic, social, and post-secondary success. And I am so excited to be starting this off season 4 with a returning guest and my friend, Robert McKinney. Hi, Bob.
Hey, thank you so much, Carolyn. And it really is such an honor to be here for the kickoff for season 4. And congratulations to you to getting into season 4 here. I'm sure this is going to go on forever, I hope.
I hope so. I love it so much. Okay, you think that I'm lucky? Y'all, let me tell you a little bit about Bob. He's a speech pathologist like us, right? But he truly has the most unique background. Hold on, listen to this. He holds a master's degree in communication disorders, international relations, and education, right? He's the immediate past president of both the California Speech Language Hearing Association and the Corporate Speech Pathology Network, right? As if that's not enough. In his day-to-day work, he is the lead SLP for the Sweetwater Union High School District, and he also teaches phonetics at San Diego State University. Now, if that's just not enough, he speaks 6 languages and has worked with clients for what, over 80 countries, right? I mean, literally, I don't know how we could not have a better guest for this episode today. All right, y'all that are listening in, please don't forget that every episode of School of Speech is offered for 0.1 ASHA CEUs. And if you are here live, first of all, thank you. I want to make sure that you do get credit. So at the end of this course today, be sure to pop back onto SpeechTherapyPD account and fill out all those course modules, including the one that says complete course. All right. We are so glad you're here. All right, live listeners. We have a big group today. We love it. Jump in the chat. I will be moderating the chat. We love your comments. We love your questions. We love interacting with you. So jump in the chat. Let us know where you're at. I kind of love that little rhyme. So jump in, tell us where you're at. And what we'd really like to know is, what is your current population that you're working with? What age group? Okay, so do that. So while you're doing that, let me just do a little more housekeeping. Let's do some disclosures. For me, I am a salaried employee at Portland Public Schools, and I am the co-founder of A Place to Start Therapy, which is in production. I'll tell you more about that later in another date. But my best job ever is I do receive compensation from Speech Therapy PD for hosting School of Speech. I love and wait for Wednesdays. Love it. All right. Robert McKinney is employed by the Sweetwater Union High School District and San Diego State University. And he's also a published author, and his book is called Here's How to Do Accent Modification. Like, he does it all. He is a member of ASHA. He also serves on the board of directors for California Speech and Hearing Association and CourseBan. And if you have ever wondered about getting involved in your state association, guess what? Bob was on last season or the season before. Can't remember, but it was amazing. And he had his first episode for School of Speech was Connect Success, the importance of state associations. So you're going to love him today, but if you want to hear more, go back and listen to that episode as well. He's like just super duper. Welcome, Bob. I already said hello. But this is special because this is the kickoff, and you are our VIP. Like, this is, I mean, I know we're like celebrating and partying over here. I love it.
Well, I'm a big fan of SpeechTherapyPD.com too, and I think that you have so many offerings, and I think just looking at all the podcasts too, you have so many different podcasts out there, and just so many ways to get CEUs and really great courses. So I know all of us need our CEUs. So I guess I'm going to throw a pitch out there for you guys.
I love it. I know. I love Speech Therapy PD. We do so much. And we've got people from all over the place. Okay, we've got some people that work elementary and high school. Wow, middle school, oh, I love it, you guys. I love it everywhere. I love it. Okay, let me keep going. Okay, I love seeing who's with us today. Okay, we are going to be talking about high school therapy. Let me just say, high school, right? That's like a total vibe. It's like this weird, magical, somewhat terrifying for some of us that have more of an elementary background. This is where like teens are figuring out who they are. It's like this mix of like, I am a grown-up and I still trip over my own backpack. I mean, it's like, who are these people? And the best part is when we are secondary SLPs, we get to like be part of this chaos, right? So why don't you start us off, Bob, and let us know, like, how did you get to secondary? Like, has it always been that for you, or tell us your story?
And also I do want to talk about that, and also just reminding me how much there is a little bit, sometimes I know for newer SLPs or SLPs who aren't familiar with the secondary setting, that there can be some anxiety. And I remember one story, because I place interns from my district too, and I've been doing that for quite a while. But I had a lot of times they'll ask for high school or secondary, they might want it. But I had one year where I think there was just one student who really wanted high school, so she asked at the university. And when they announced the placements, they said, and we do have a high school placement, and there was an audible gasp apparently. So a lot of the students were panicking but it was this one who had requested it. But we get different years. This year currently at our university, where we take from a couple, but there's high demand. So it is, I know with a lot of people don't really understand it. For me, it was a natural fit in a way. I'm a career changer. So as you mentioned
Mhm.
with my background, I had a 26-year ESL career that overlapped with my SLP career. But I've been doing this now for over 20 years and just in a high school. But at the time when I was in grad school, I really didn't have much experience with young kids. And I don't know if that's part of also possible, part of being a male too, being a little bit different than most SLPs. But
Mhm.
I remember in grad school that one of my supervisors asked we were doing staffing and she said, well, who has experience with young kids? And of course, all my classmates raised their hands and they had extensive experience. And when it was my turn, I said, well, I don't really know anybody young at all. I don't interact with anyone under 20. And so I just felt so out of place. And of course, they threw me into preschool language group and all that. And I learned the cleanup song and everything. But when I got out, I thought, well, I was thinking medical a bit, and but that didn't. I tried it, and that it didn't seem to fit with me because I think the language area is what attracted me
Mhm.
to the field so much with my language background and my ESL career. But then I thought, well, the high school, that lines up with my experience. As an ESL instructor, I hadn't really worked with the young kids. I'd done mostly adolescents and mostly adults, really, but some adolescents. So it was a natural fit. And I hadn't had my son. He's 17 now, so it was before he was born. So now I feel like I really feel like I have a lot of experience raising my son with my wife and being with his friends and seeing all of that. So now I really feel more comfortable around the younger kids. But for me, I was much more comfortable with the older kids versus my classmates who really were a little bit, they had some anxiety about it. And our
Well,
district, the one I picked, it's a wonderful district. I just wanted to throw a shout out about Sweetwater, especially our department, because we have an amazing department. We've really worked hard to create a team and just really part of it, I think what helps too is we are attracting people who are interested in working with the older kids. So it narrows it a bit. We really have a wonderful team. We think we're probably the largest all secondary district in the country. I mean, I can't really prove it. I've looked into it, but we've got to be up there because we have right now about 33 SLPs. And usually when you have these all secondary districts, they're smaller because it's not a unified thing where they are or something. But in our case, we just happen to be really large. So that's really created an environment where we're specialists in that area. So that's
that's
how I
right.
got into it, and I just love it.
And that's why I asked you to come back on. I mean, seriously, his entire district is high school.
Yeah.
It's
And
crazy.
we've
I
got
love it.
middle. I mean, and
And
middle,
or
I know
secondary, I
we
should
put
have
in the
said.
title, we put high
Mm.
school, and middle is, of course, going to line up pretty close. There are some differences, and I did 10 years at a middle, but it's still the general same feel, even though, hey, maybe we'll do a follow-up and we'll do middle.
I'm in. I'm in. A shout out, Susan. I know you're not expecting this. Susan Bean. She said this was high school is the best kept secret.
I
I
hear that
think
a
you're
lot. We
right.
get that a lot. Yeah, a lot of the people that we've hired over the years too, or people interns and things have told us, they think, wow, this is it, and they almost don't want to tell their friends.
Right? Because they don't, yeah, because they want to keep their job. I love it. Okay. So you let's actually talk about the role of an SLP. Well, not that's a big question. I mean, specifically
Yeah.
high school, because how is it different than
Yeah.
elementary?
I
So for
mean,
those,
one thing that jumps out at me right away when I think about it is having done it for a while is, just thinking of the areas of the needs for the students that we work with, because when you're looking at how do kids come on our caseload? I mean, how do they become sort of obvious or they get referred or whatever happens? But, obviously you have some of the students who have extensive support needs that are going to be on everybody's radar very early on. But for a lot of the kids, it's really about the way they sound. So it's our tick that comes up and it's starting to peak there in first grade or whenever that peaks. So you've got a lot of kids where the way they sound, because they're not really doing a lot of heavy duty language work they're working on literacy, right? But they're not reading all day long or that kind of thing. So, a lot of times they're doing play-based activities or things like that or listening to things. But when they speak, they come on people's radar. So that you've got that whole group of kids that are working on our TIG. And then later, as the demands, the literacy demands and the content, that starts really accelerating pretty rapidly, right? And then that's when all the language kids come on later. So that's probably the primary difference that jumps out at me right away, because when you're working in the elementary, our tick is a big part of your day. If not, I mean, it could be all your day for some people, but half the day or whatever it is, it's a lot, right? Versus those kids have all been remediated by the time they get to high school. Not all, of course, but I mean, the vast majority. So you're not doing as much artic. You have some artic that you're doing for kids that have other needs. So, but to have the pure artic kids, I have on my caseload just one or two of those usually. I actually this year I think I just have one who's a speech only with just artic. So that has shifts, but all the language kids come on the caseload, right? And the social language and all of that. And so that is one of the major differences. And then, just thinking about how their schedules change and really what happens in the coursework with the kids in elementary, a lot of times they're in one classroom all day long with one teacher, or you might have a couple people in and out of there. A lot of times they're staying in the same place versus on a high school campus, right? They've got the passing period and they're going to different classes all day long, different teachers, different expectations. You have different things going on, testing, and you have field trips and a variety of different things that high schoolers go through during any kind of week. So the schedules get a lot more complicated. The range of language becomes, I mean, you could just obviously you're going to see it. Of course, you always have a range at any age, but by the time you're at high school, when I'm showing sometimes like shadowing, a student will ask me if they can shadow or something. I think we were doing a little less of that after COVID, to be honest, because it's just getting a little tighter to get people on your campus. But when I would do that, I would show the range was very extensive. You have some kids who are non-speaking, right, where they might have very limited vocabularies, and then you're going to go and pull a student who's going to UCLA next year, right? And so in the same day, you're seeing that whole range. And a lot, I don't want to forget the middle, because we really there's a lot of really great work that we can do in what we often call the moderate level. So yeah, that's one of the major things. And then really that idea of the counseling part, the advocacy becomes very important, and being part of a team, because you may be, if you're the provider at an elementary, you're probably the case carrier for half your kids, if not more, right? And I'm only the case carrier. Like this year, like I said, let me think about this. I have only two this year who are both fluency kids. And then my Arctic guy that I mentioned, he actually does have some other services going on. But so that's a big change. You're part of a team now. And you're doing a lot of counseling, advocacy, sometimes like changing a class is part of what you do, getting in there and advocating, or getting a student to change a class.
Oh, change a class. Well,
Yeah.
You made me think of a question about, so how do you explain? I could see, okay. Whoa, Carolyn, words. The since the role is sort of different in the secondary level, how do you explain that to admin and teachers?
Yeah.
What your role is like?
Well, there is a lot of confusion, because I think this goes at all stages, but it probably is more for us because it's really common, the sort of age-old thing where if you go to pull a student and the teacher says, "Oh, well, I don't hear anything in his speech or anything," you say, "Well, we trying to explain that language part, that speech language." And that's not really clear for a lot of people outside of our field, to be honest. It's one of the most fundamental things about our profession, but that's not really a thing that people think. They think of, there are a lot of high school teachers out there who think that we basically are doing our TIC, or that we're working on lisps all day long or something like that. So yeah, there's a bit of that. But in the special ed world, everybody knows what we do and all that. And I'm a big fan of the collaborative model. So I'm out there all the time and everybody sees what I do when I'm doing it.
Okay, cool. So do you find that you are out more?
Yeah, I mean, I'm a big fan of the collaborative thing, and I've given many talks over the years, including at ASHA and CASHA and other places, about the collaborative model, so the push-in model. I'm a big fan of that, and I think in the high school setting, it's really helpful, especially with all the different things going on and the schedule changes and all that. It's a nice way to do it. It's very efficient.
Okay, that was such a nice sort of segue to my question. Is okay, so kind of your role, well, wait, let me stop. Your role as speech pathologist is also, besides superhero, is counseling and advocacy. It's a bigger, like, student support role. Because you said change of classes, helping them navigate that. So what are you actually doing with these students? Like,
well, because I look at it as almost like a three-way thing, three things that I divided up. You can divide it any way you want, I think. But for me, it makes sense to think of like there's the therapy part that is really what goes on in grad schools, like what you learn, the ASHA stuff, or how to do things and all that. That's one part of it. That's 1/3. I mean, not exactly thirds, but one of the three things. The other role for me that's really important, if not more important, is the advocacy and counseling piece, where you are there for your students. You're trying to develop them as future citizens and really just adults and preparing them for life. And so you're a lot of times that's dealing with some of the other larger issues that might not be in that narrow framework of what a speech therapist does, but it's what I do and a lot of us do as SLPs in the school setting. So that could involve a lot of things. And then you have that third piece, which is the one that's not so exciting because that's the bureaucracy and just the job part, right? I mean, sometimes it's just filling out a form or doing something that doesn't really make that much sense, but that's a part of every job. But I think of it as those three things that really, and the advocacy piece really gets way up there as far as, and what's the ultimate goal? You're trying to get the students to be, a lot of times it's really the end of the line for them academically. This may be the end when they hit 18 or 22 and they're not going to be in the school system anymore. They're not going off to college often. And we could talk about that too, of course. But you're preparing them. You are entering life and you're trying to get them to transition into that new role.
I kind of like that. I mean, end of the line, but is it, or are we bridging them to?
Well, yeah, and I did. That's probably the worst way I could have said that, but
I know. I was like,
but
that
I mean,
does
the end of the
not sound like
academic line.
Bob to me.
Yeah, and I'm a big proponent. I really think that there is a college bias that we have, and I see it on my campus all the time. I mean, if I walk around, I was, of course, at work today, and I walk around, there's all kinds of banners of colleges and everything. And on Wednesdays, we're supposed to wear our college stuff. And, we all pitch college because we're, of course, there's a logic there. You want to push the kids at the high school. You want to get them into college. We want more people in college, get your education. We're all highly educated. We know the value of education, but that's also forgetting that we do have a lot of students where that's not really the best path for them, to be honest. And I think we have to be really open about that everybody ends up in a career. And so a lot of times it's really that idea of not just really making this thing that it's all about college, 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 because some of our kids, that's not the right path for them. And we're going to make them feel like they're not successful versus let's pitch college and career, because for some people, college is the natural path, others for career. But I tell all my kids, like, we all have careers. Like, I really don't know anybody. I'm sure there are people out there, obviously, some people who are entrepreneurs who really never had any kind of, well, I guess they still had careers, right? But, everybody's got a career.
Everybody's doing something, right?
Everybody's out there
and
working.
we talk about, because it's not just, I mean, school is not just, the end of school, like 12th grade, you're done. We've got transition.
Yeah.
One of our listeners, KK, she loves working not only in high school, but also that community transition program for those 18 plus. We do have students that stay, like you even mentioned before, that stay with us to actually some of them 22. And we have to prepare them for life, whether life is college, life, a career, life in society. But we did we've had several questions, and one of them I wanted to ask, because you were, before we get too far into other stuff, when you were talking about let's go back to providing the therapy. And you were a big proponent of push and collaboration. Could you, Ariel, thank you for your question.
Yeah.
If you would kind of talk to us about how are you successful in pushing in, especially on those more academic high school classes?
Yeah.
Yeah.
And because I think I didn't really address some of that. And so I'm glad we brought it back to that. But of course, you're doing the whole range, which is one of the greatest things about this job. I mean, that is the number one thing in my mind, as far as the autonomy that you have, because you have come into this field. And I've obviously supervised a lot of clinical fellows and had a lot of interns, that kind of thing. So kind of explaining to them why this job is so great. I think that's the first thing I start with, because you really are not, you're just have your caseload, and then you're deciding the best way to deal with that and to handle it. It's really powerful. And of course, you're going to do some pull out, you're going to do some one-on-one, you're going to do some small group. Those can be very effective. I believe in all the modes. There's nothing, I'm not saying you have to do one or the other, but in that mix, you really should consider the collaborative model where you're actually just going into the classroom. And so I do all the pull out, I do the one-on-one, all that too. Of course, it's very effective. And then you do but the push in can be really great. And a lot of times people, it might be a little out of their comfort zone. Not everybody does it. I don't really push people and say, you have to do this, but I just recommend trying it. An easy way into this is really just going in and observing the students in the classroom and collaborating with the teacher and discussing afterwards. So that kind of thing is a really first step that you could do. And then you can build up your comfort a little bit by maybe trying a stations-based approach where if you've seen that before, it's where you've
Sure.
got little tables maybe, and then you're running around and you could run your own table. So in that's a good foot in the door because then you're really running a small group, but in their environment and you're shuffling and seeing all the kids. And then you kind of go from there and keep building up until you get to the point where you're just running the class in a sense and working with the teacher, of course. You're not, completely taking over. The teacher's still involved, but you're really running the show. And I enjoy that model. I think it's really great. It has a lot of, and there's a fair amount of evidence for the efficacy of that too. A lot of recent stuff has come out, some meta studies that have really shown how it really helps with the generalization. And I just
I
think it's
think
great. It's a lot of
I
fun.
agree with when you're saying like you are sort of you're working with the teacher, kind of a co-teach sort of thing. Because like some of the comments were like, my students would die of embarrassment if you pushed in and you were like focused on me in my class.
But see, that's the beauty. They don't know who's on your caseload even.
So, okay, so then I guess speak to that because I think what people might have been hearing is like you go in, you're pushing in, and you're doing therapy in the
Well, no,
classroom
but
with
see,
this
when you're doing
kid.
whole class, you're working with all the students, which I
Okay,
think is such a great because it really gives the work that you do can hit more people and can affect more people that way too. Of course, you know who's on your caseload, and the ratio is going to be different, right? Because if you go into mod severe, then everybody's on your caseload, or they could be on your caseload, basically. You get to moderate, it's going to go down a little bit still. You could probably have everybody on there. By the time you get to more of a mild moderate, then you might have half the class or just a quarter of the class or whatever it is. Those are the levels that I think it makes the most sense. But when you're in those environments, you're just dealing with all of them. No one should know that this is
okay.
my speech student. No one, they don't know because how would they? I treat them all equally. I know my kids and I know what I need to work on with them, but I also know about the other kids. I don't just treat them differently. I mean, I'm just informally figuring out what I need to do to help them.
Which kind of makes me the question like, what type of goals are you working
Yeah.
on?
Well,
Like,
functional goals too, especially as we get to the end there, as we were saying, as you're trying to transition them in there. And of course, we haven't really, it's come up a bit in this talk so far, but federal law says that they can stay in school until they're 22.
mhm,
California, actually, it's only been a couple years now, or less than 2 years, I believe, that we have the alternate pathway here in our state where the students actually receive a diploma. Because when I started, they didn't get a diploma, they got a certificate of attendance. And now in
mm,
California, they all of the students get diplomas, but they also, the ones who are on this alternate pathway, they can continue to get their free education and services until they're 22. And that's going to be much more community based, much more functional. But all the goals, yeah, you're trying to get them as functional as possible because you are looking at the fact that they're going to turn 18. And like I said, that may be where they decide to go to work right away. And that
mhm.
may be something that's going to make the most sense for them.
So I get I forgot Tiffany was asking if you had any you know, supports for SLP transitioning from primary to secondary because I'm assuming we don't want our therapy to feel babyish, right? Not Tiffany, that was
Yeah,
not to you saying babyish. Sorry, but not at all. But I'm just saying, like, just any SLP that is used to doing game-based,
right. Well,
younger,
we
how
do all
we're
that too.
game.
I do see the risk there, and it's happened before where sometimes people may have kind of that, like you were saying, and I think we're trying to find the right words for it, but maybe just really going a little bit low for the students, but
We want to
where you're
respect that
babying them.
these, we don't want babies. We want
Right.
to baby them. We want to respect them
Yes.
at the age they are at, showing respect, to
Yeah, so that takes
them.
some time to develop, I think, just to get that feeling where you're natural, but you're still talking to them as young adults or even adults on your caseload. But and again, it's going to depend on where you are, because if you have the students with extensive support needs and you're in the moderate severe classroom, then you're potentially reading picture books or doing some of those things where you're more animated and really that
Mhm.
could be like working with elementary school kids at times, right? There's going to be some similarities with the way that you behave or you present yourself in those environments. And then as you move up though, right, then you're being more really just respecting them as young adults and really trying to just of course you're grading your vocabulary a bit, but then with
Mhm.
some levels you're really just conversing fairly freely, right? With some of the,
Right.
you've
Which you
got a 17-year-old
can.
who's getting what we call mild level of services, right? Then you're having an adult conversation. or like you would with anybody at that age.
Sure, sure.
So
So,
yeah, I can see that. That can be part of the skill set, I think, is really just creating a where you have a persona or the way you interact with the students. And given that range that you're working with, going all the way from non-speaking in one day to, again, someone going to a four-year college,
mhm.
you have to be flexible as far as, and again, always that principle I think we all know, which is really you're always presuming you're kind of adjusting down as necessary, but you're not going to start super low when you meet a new student to just assume I'm going to have to pitch it down here and talk really slow or something like that, or just use one or two words. I mean, I'm always starting off just trying to be as natural as I can to see how that goes, just to,
Well,
being
that kind of makes
respectful.
me go into what listener Jacqueline, hi Jacqueline, she is asking about assessments,
Yeah.
especially this also ties into Tiffany that's transitioning to upper
Okay.
grades, is like, what are some assessments that you feel would be really important for SLPs to
Yeah.
master?
Well, I mean, I would start with the good news, which is we actually do a lot less of that than
Woo,
you probably do in the elementary, because
okay.
when you have students who have really a track record, right? If you have students, again, with extensive support needs or that kind of situation, then you have their initial, you have a try, another try,
Mhm.
right? Sometimes you're on how many tries are you in on this? And so really going back and doing a whole battery of standardized assessment in those cases doesn't make much sense. So a lot of times we're doing much more of a performance-based, and please don't think that those are any way. A lot of times people think that's somehow inferior or I'm just doing this type of assessment. These are valid assessments that are extremely practical and functional at that level, right? Because you're interacting with them, you have the body of all the standardized stuff, but now you're looking at how they perform in their classroom. Again, that's another push for the push for the push-in model, is that you see them in their environment, so you know quite a bit about how they interact in the academic world. We do have some standardized tests, of course, and we use those, and it just depends. There are some people don't want to do much of that. They'd rather do more dynamic type assessment or performance based. Other people might just do only standardized. So I'm not going to make a position about what you should do. That's everyone can decide for themselves on that. But we don't have as many tests out there, so we're a
Right.
little more limited, but we
Hmm.
still have the major ones out there. Like we've got the Self 5 and we've got, Self 4 in Spanish. Self 6 Spanish is coming out at some point before I retire. And then some of the vocabulary tests and that kind of things, social language development tests. So we've got a castle there. We've got tests. There's a fair amount.
So, I do like hearing that you're more dynamic assessment, because it really is more geared to exactly what school-based SLPs are supposed to do, is to be finding the gaps in where their
Yeah.
curriculum is and where they are, and bridging that, and helping just remove the barriers so they have access. So I
Yeah, and it
love,
reminded me of a point too, and I don't know if I wasn't sure it was going to come up at all, but just I think one of the nice things in some ways is that the parents are, so I think what for me when I did my off-campus work as in grad school, and I was in an elementary and I really enjoyed it, but being at an IEP where a student is first hearing, or the parents are hearing about a student that they need additional support and this might happen, that it can be a little bit tough for the parents to hear that for the first time, versus when we're working with our students most of the time those things are known to the parents. So now they've adjusted and they've adapted, and now we're just able to have a comfortable conversation about things. What's a hot topic for us and came up in an IEP for me today is that transition piece. Like what's going to happen after this?
yeah, I do want to get into transition in a minute. I think we have a lot of questions on assessment
Yeah.
still coming in,
Okay. Hot topic.
about, I mean, and I love, because I think I've been out of the secondary, like campus space. I just do the feeding and swallowing now, but I am loving all of this.
Yeah.
So Savasti is it TOAL 4? Toll
Yeah.
4?
Okay.
Are you familiar with that one? I'm not familiar
We,
with that one.
I don't think we do a lot of that. I'm familiar with it, but I don't hear my colleagues doing much of that, but so I don't have much to say on that
Well,
one.
I'm going to Google it now because I
Yeah,
want, yeah,
it's out
see.
there. We tend to do mostly, if I had to just think of the top tests in my district, it's the Self 5, the Castle 2,
Okay.
the PPVT 5 or
Yeah.
whatever number they're up to, the EVT 3 or 4 or whatever number they're up to, right? And that kind of
Right.
stuff. Those are the ones. Again, the social language development test, that kind of thing. We do that. The self meta linguistics. I do a lot of bilingual work and multilingual work. So of course, like I was saying, we do have the self 4 in Spanish right now, which is what we use a lot of that.
Oh, thank you, Stavasi. Now this makes sense. I don't know why I was just brain dead. Test of adolescent language, PERT
Yeah, test
4.
of
Oh,
adolescent language. Yeah,
sorry.
I've heard
Thank
of it, but I
you.
don't.
I
And we
know.
might have one in our district. I'll have to ask, but I don't hear it come up much at our speech meetings.
Well,
So
they're
no comment.
saying, right, that it's great for written
Okay.
and expressive parts. I love that. Um, we love that. Thank you for that. Okay. I am sorry for this cough. All right. I think we got that some great ideas for assessments. I kind of want to think about more about interventions, talking
Yeah.
about like goals. What do we need to think about when we're looking at this student? Because again, I think a big takeaway is that um, we are preparing these students for life, right?
Yeah.
For their life after school. The reason we even have school is that they go out into the world and become amazing citizens of our world. So when we're thinking about writing a goal, how do we make sure that it's functional? How do we make sure that it is a
Yeah,
goal
and of
that's
course, and we also
meaningful?
have a transition plan. So as when in the year that they're going to turn 15, we have to start creating these goals that are going to be based on issues such as what are they going to do for post-secondary education, where are they going to live if they do that, or employment. So you've got your college type goal, employment, living, those types of goals all become a part of the IEP. So when you have the speech only kids, you're also asking them or interviewing them too about what they want to do. And you're providing some, again, getting to that transition piece, even with your speech only kids, a big part of what you're doing is really talking about, have you thought about what you want to do, or just discussing that kind of thing. And keeping in mind, as most of us, I mean, I'm a huge career changer, and if you'd asked me when I was 30 what I was going to end up doing, I mean, so we never expect them to know at 15 or 16, like I want to be a this or that. In fact, a lot of times they have that idea, but it's not very practical. But but really helping them out to figure out, oh, well, what do you like about that? Or what do you think they actually do? And started really getting into what that entails. And then a lot of times you could start figuring out other possibilities for them to get started in that world, or that might be more achievable right away. So yeah, there is a lot of that counseling. So we do want to keep things functional again. We also share goals. I don't share, if I think of the percent of goals I share, it's not a huge amount, but I try to do it when I can. I would say
Mhm.
maybe it's 10% for me, or 10 or 20, but that's really nice when you can share a goal at that point, especially with our older kids in transition. Now, with those kids, I'm mostly sharing goals, and I'm mostly doing consult for a lot of those kids too. So we're not doing a lot of times the direct services because it's community-based instruction. But you have still your traditional goals that you're doing with the kids that are going to focus on what they're doing. Coming from the ESL world, it was a very different environment. So we were really not, we didn't have goals that this is the one goal for this year, or the two goals, or whatever it was. It was a very different feel because you're just trying to take each student to the next level at all times. So I've always kept a bit of that. I mean, a lot of our students have global needs. And so I think there can be a little bit when we focus on one or two specific goals, it doesn't always help, I think. And there can be some games that get played with that, to be honest, where it's all focused on one goal because that way you could say that you achieved it or this kind of thing. Some of that stuff I'm not comfortable with, right? So I do want to keep in the back of my mind always that no matter what I have for the goal for the year, I'm going to be working with their global communication needs. And even more big picture than that, I want them to just enjoy communicating and feel that they can be successful at it. That's number one, right?
So
So
the goal
yeah.
is just global communication.
Yeah, and so of course you're going to have your thing, and we're part of the IEP system, and you've got to have your goals and track them. And there's a good point for that, right? We don't before we had goals in special education. I mean, it's before my time, but
Mm.
there was much more chance that things could just be really nebulous, right? We're just working on something. Versus when you have that meeting with the parents, yeah, you can highlight certain areas. But I think for a lot of our kids, there are multiple things that you're working on. But so we do have the traditional ones, of course, for anybody who's doing the artic or fluency or that kind of thing, you've got your goals. It's not going to be that different, really. Even though things like fluency, you're probably doing more, a lot of just self-awareness or
Mm-hmm.
self-education about fluency and really that bigger picture of not just having the students understand that there's nothing wrong with being someone who stutters, that it's not some kind of thing that they should, they don't have to treat it as something that has to be fixed or corrected, that it's really something more about awareness of others and listeners and that kind of thing. So you've got your kind of traditional stuff with a lot of processing type goals. I do a lot of goals focused on things like, main idea or comprehension questions, that kind of thing, paraphrasing, a lot of that. And then specific ones that come up, of course, for each student to be individualized. They might have a certain thing that they do that you really want to address. And then that social language stuff, because that's a big piece, right? My district is wonderful in the sense that we have a social communication class in many of our high schools. And in the old days, before we had that class, I don't know how long we've had it, probably 10 or 15 years at least. And before then, of course, I would pull out my social language kids and we'd be in the room and do that kind of thing. But in this class, it's great because they have it all week long. And then I go do my push in there, but it's usually for students who really are focused on just that area, just the social language.
So, yeah, I love that there's a whole class on that, then, because then it's built in naturally that you're going to be working
Yeah,
on social communication, because like constructing it or creating it is just not authentic. Um,
right.
like and I do love the fact giving us some ideas of like goals that you're working on really does help those that are transitioning to understand that. I mean, I think if you stopped and thought about the goals that you are working on, would this goal matter after graduation? Like,
Yeah,
should we be working on something that doesn't matter?
right. And then as we get into the older, the transition kids and all those, then that's why sharing the goal makes a lot of sense too, because you're really there just to support them as they are doing community-based instruction and they're really on the job site. And another great thing about our job just in general is getting out there with the students, the ones who are in the transition program or even when they're in their field trips, but doing that community based with my moderate students or moderate severe, sometimes they go to IKEA or they go out to
Hmm.
the mall, and being there with them to be part of their just creating an emotional connection, but also seeing opportunities to sort of spot treat some communication stuff. And then with the older students in transition, then they're going off to the workplace. So I've gone many times where I'm with them and I see, what do you do during the day? Oh, and what do you do? And trying to work on anything that comes up for that, how they're going to handle some of the situations at their work site or the vocabulary involved in it. I mean, we've done all kinds of car washes and dress for less and the
Hmm.
food mart and all that
I
stuff.
love
It's
it.
so much fun. And then the fun stuff, go bowling too with the students, right?
Okay. So again, now you've done this wonderful segue to what I wanted to ask next, because all your SLP wizardry that you are doing, obviously, I'm hearing isn't solo. You're like a team, right? So
Yeah,
like, let's
yeah.
talk about like collaboration, because if
Okay.
your kids are going into the workplace, right? How are you collaborating? What do you do?
Yeah, and that whole collaborative model and really trying to get in there and interact with so many different professionals and then thinking of that goal, and I think it is a part of the whole collaboration, of course, collaborating with the student too, but also trying to get that student to be more independent so it's student driven so that even at the end, as much as possible, that as they get older and they're high school or they're in transition, that these are self-directed IEPs if possible. It can be a little bit idealistic to imagine that students are going to get up there and tell you this is what I want to work on this year and this is my goal and I've checked it and I'd rather have this many minutes or
I
that kind of
love it
thing.
though.
That could be a little idealistic, but the reality is to get them and more involved in it and all that. So you're collaborating with everyone though, but on your campus, yeah, again with the collaborative model, you're out there more. So I think the that idea that administrators and teachers don't know what SLPs do a lot of times, that's true, right? And it can be true if you're just doing pull out, there's almost this mystery. And I think when you start as a first time clinician, people talk about imposter syndrome or that kind of thing.
Hmm.
I think there is not necessarily a desire in the early years of your career to demystify. You almost want to mystify, right? It's almost like, what are you doing in that speech room? Just my magical speech stuff, that whole thing. And but when you get more comfortable, then you can get out there and you're really you feel okay just demonstrating this is what I do, and really not, that's the best way to get the environment going in a classroom where some of the things that you can do as a speech therapist is going to basically rub off on other people, the aides who are in there. You've got multiple
Yes.
aides in these classrooms, the teachers and all that, without being heavy-handed, where you're coming in there and telling an aide, I want you to do this, you need to check, because I'm not a big fan of that. That's a short-term kind of thing that's probably going to build resentment,
Mm-hmm.
or something like, who's this person coming and telling me what to do? Versus if you get in there and you're just doing all this stuff. A lot of times I've had situations, where you'll see that what you do carries on when you leave the room because you've shown it and you're not making a big deal out of it. They're just watching, and then they'll start doing some of that stuff. So yeah, you're collaborating with a lot of people. In my district, the school psychologist is a major player because that's our LEA rep. But it
Mm-hmm.
depends on your district because you might have an AP or somebody else doing that role. But yeah, you want to be collaborating with whoever's your LEA rep and in charge of your special ed, of course. We love the fact in my district that we're all essentially equals, and we don't have like somebody on the site that's really our boss or something like that. We have a head of special services, special ed, but it's actually a very flat structure in my district. We're really just have kind of that head of special services right above us. So collaborating though with all the administrators who are involved in the IPs, the LEA reps, school psychologists, of course, the nurse, we have a nice connection there you have to have, right? We've got OTs coming on campus, PTs not as much, but we do have the OT thing there. So you have ERMs, so the for mental health services, and you've got a close connection there because sometimes your kids will have those services too. So yeah, just being open-minded, and there's a lot of good evidence. I think this whole interprofessional practice thing comes out of the healthcare world because they had much better outcomes when everybody knew what each player was doing on the team. And
That's
it's
what I
not like you could
love.
do what they do, but you understand what they do.
I mean, it makes more sense, especially in the secondary high school level, that you're all collaborating. Because
Yeah.
at this point in their education, we should all be collaborating. But I want to go back to a point that you've said that it should be student led, because I
Yeah.
think that is so important. Right, maybe the student is not able to fully run their IEP, but they should be, what is their priority?
Right.
What do they want to work on? I mean, talk about adding the perspective of your client into your goal writing. Is what is important to the student? What do they feel that they need in order to be successful in life?
Yeah. And another pitch for my district there, I've been saying a lot of nice things, but they also started a transitions class, which is not actually the greatest name. So I will say something negative because it's confusing. It sounds like a transition program, but they have a transitions class, which is usually for 11th or 12th grade students who are often it's usually the mild moderate level of services. But this class is really devoted to just like life skills. And part of it too is, and it's pitched for students who are not going to go even to community college. They're probably going to go straight to work, which again, we often encourage, which I think a lot of times people forget about that. But so it's kind of pitched more to that student where if they went to community college, it might not be the best route because they might be there for 7 years without anything really happening or coming of it. So anyway, the point of this class is really life skills, but also about the IP. They analyze
Mhm.
what's the IP, how does it work, what are your rights, what do you work on, and really getting that. A lot of the students, of course, in high school, in the elementary, they may not be as aware of what's going on. In the high
No,
school,
no.
sometimes they may know, but they're also ashamed of it a lot of times. And so we want to develop that awareness that this is something powerful that gives you rights that can help you if you're in a class, and this is going to give you like a little bit of extra support, and you have to tell us though what you need, but you've got this power now. So really trying to get them to advocate for themselves and helping them along that
I'm
path.
hearing like advocate for the accommodations that they need, which is going back to, because we've got people asking more about standardized assessment and comments about how it's not it's not normed on the majority of the population we are servicing at the secondary level, because we are doing more of they're not just speech only. These are complex kids that we are now
Yeah.
working with.
Yeah.
Our biggest population in the secondary have more than just a speech component. So a lot more going on. And so I think it's going back to emphasize that, yes, we do have some standardized tests, that because a lot of our districts are like, you have to have a standardized test as part of your
Yeah.
battery. but that can't be it because it is not normed on your population. That is really why you've got to do your dynamic assessment.
Yeah.
Your what did you performance based? Yeah, I always
Performance
call it
based,
dynamic,
yeah.
but I do like saying performance based of really how are they performing, and to be writing your goals rather than a standardized test, which is not normed on them. But
Yeah, and
really,
I'll give a quick shout out too to my neighboring district there, which is a wonderful district, San Diego Unified, and they've done a lot of great work with really getting people to be careful about even how they use the language they use, because you'll hear SLPs, and we all do it, but where you say something like, "Well, I just did kind of an informal thing where but that's not what happened. You did a performance-based assessment, and really to be very sort of like presenting it as something that is, because it is good. It's evidence-based. It's good. It's going to be very practical and effective. But I think we tend to treat it as, oh, I just did this kind of thing. And we shouldn't think of it that way. But we do. Yeah, I know the feeling though about the norms and everything. As someone working in high school, a lot of times a test kit will come out, or I'll hear about some great test, and then I see, okay, norm to age 8. So it's
right.
like that. People talk about the Delve, I think, and I think that goes to 8 or something. But I would love to try it out. But sometimes I have some of those kits because I could use them for the extensive support needs kids, and just not, again, not reporting scores or anything, but just to use it. But we
Sure.
don't
I
have
mean, you
as
can
many
use
tests.
tests and use tests to get information that you need,
Yes,
and not report it as such. But I
exactly.
think when I want to go back to words that we use, because I think that is a really important when we just say, oh, I just did an informal.
Yeah, yeah,
No, how much to really build that up when you are really individualizing your assessment to that specific child. It's called informal because it's not a formal standardized test, but let's not call it that.
yeah. That's why
Let's come
that type
up,
of thing like
let's,
performance-based is really, I think, a more accurate term, and it's really
so,
people should be proud of the work that they do in that area, and really not make it sound like it's not as good or something. And then, it
right.
just depends, because some districts don't do any standardized testing at all. I do like standardized testing. I think the balance there, you're always balancing it
Well,
out.
the students are taking tests in every course. So everything is
Yeah.
test based. So yes, we're doing tests, but I think the important part is when we are looking at the students that are in the secondary level, that we do need to go beyond that, because it's not going to tell us exactly what the student needs to transition out of high school and into the world. And that's the whole reason they're in school.
Yeah, and
So,
these tests are well developed. I'm a big fan of a lot of these products, and I've worked with the test developers. I'm a bias reviewer for the Self Six, as I mentioned, that should be coming out at some point before I retire, but it's going to be a while. But I think I do respect the work that they do. And when you look at some of these vocabulary tests, I mean, these are extensively tested, and they really have them slotted out pretty well. And for me, if I just pulled a kid randomly from my campus and tried to assess like where's their vocabulary level, I mean, I've been doing this a long time, but that would be really tough for me to really get an accurate, versus
mhm.
those things are pretty well done nowadays when you look at them.
Okay, okay.
But other times you want to be very careful, and and again, the bilingual thing, which I do a lot of work on, you have to be super careful about all that stuff. So yeah, you want to go really carefully with the bilingual stuff.
Sure, sure. And so, um, let, okay, so I think we've ad nauseum done assessments, and thank you for that, because I did have a lot of
I was
questions.
surprised that was such a hot topic today,
Well,
to
it
be
was a
honest.
hot topic, and I probably doubled down on it because I'm very interested in that
Okay.
too. But I want to know, how are you prioritizing goals? Like, how, I know you're saying could you give us maybe some examples of some goals? And I know that every kid is different, but just, when we're,
Yeah, again, I mean, I think with those students, yeah, it's hard to think like off the top of my head.
oh, sorry, yeah.
Well, no, I just mean as far as like, yeah, what you're looking at again at the different levels, of course. We could go through, obviously your Arctic stuff, I think is a lot more that those types of
Yeah.
goals could be pretty much easy to figure out as far as like exactly what you're doing and how you're going to write that out. And for me with fluency, I'm much more concerned, as I said, about that bigger picture. I've never in my career done anything where I said like we'll be more fluent or this or that or percentages,
Good,
fluency, or any of that
right.
stuff. Never made sense to me. And maybe if it does to anyone else, I don't mean it to be offensive, but that just didn't make sense to me. So I've always approached it much more about just self-awareness and sometimes listener education, that or that type of thing. And then when you get to those processing goals, yeah, I mean, I think you can work on, like I said, I do favor oral language, and that is totally just an opinion thing because I think there are so many SLPs that do amazing literacy work. I just tend to focus much more on oral language. So if you look at my goals, they're not going to have things related to, reading and writing. It's all going to be oral language based. But that's just me, right? So that's not everybody's going to approach it that way. But then you could have, as I mentioned, I do a lot of things like paraphrasing main idea, that kind of stuff. And then going on, and I guess that leaves voice and social language. Social language we do quite a bit of, and voices really doesn't come up too often, as I'm sure you know. And you have to basically have an ENT signing off on it, and it's pretty rare for me to have a student where we're really working on the voice stuff in the high school setting. Of course, there are some voice issues that do come up. But then for those social language students, yeah, a lot of it I think is finding that conversational balance, and really again just trying to make sure that people are monitoring listeners' reactions, because a lot of our social language students are going to monopolize. They're going to have a topic of preference, that kind of thing. Yeah. So I don't know if that helped much. But.
No, it totally does help. Sorry, and I know I totally put you on the spot. I didn't mean to do that, but all right, let's go back to Tiffany. I don't forget you. What advice would you give to an SLP new to a high school?
What advice for new?
Not necessarily a new SLP, because that's different, but an SLP that's going to be new to a high school, that's come from it could be maybe outside of school or school, moving up in age range. Like, just what would you say?
Yeah. I mean, I have a good joke answer, but I
okay.
something occurred to me.
Lay it on us.
It's like an in joke in my district, but I was going to say wear a blazer because
to make sure you look different.
Yeah, because that does come up, but that's a serious topic in a way, right? Because a lot of times when I have with my interns, or if I have my CFs that I've worked with over the years, a lot of times they're not that far removed from the high school experience, right? Because if someone's 23 years old starting their job, right? That's 5 years since they were in high school a lot of times. So yeah, and it happens a lot. I've had interns where I've introduced them to my principal, and I'd say I'd like him, and he'd go, "What did this young lady get in trouble?" It's like, and not even kidding, like seriously thinking that it's a student. So I think that can be a piece of it in all seriousness, where people may feel that almost just because of the age or just that type of thing, that they might not feel as comfortable or intimidated. And there can be a physical factor there too with the intimidation. If you have a student who, is a 6'2" male, right? Who also potentially is in one of like a residential treatment facility or that type of thing. So let's not forget that part, because that doesn't come up at all yet. But you also have more placements like that, like day treatment facilities, residential treatment. Some of that we're serving too. So that's another side topic. We could do that's for season 5. We'll do that.
Okay.
But to get back to the advice, to be in all seriousness, yeah. And again, going back when I picked my job and I took the offer, and I had heard great things about my district and I took it, but I hadn't done any work in a high school setting. So I asked my classmates who had, and I wasn't sure what it was going to be like. So I don't know. It's hard to think of one particular piece of advice. I mean, again, being confident. I think that a lot of us when you're new to the field, you're trying to, again, you might not be as comfortable getting out there and showing what you do, but I would recommend getting involved on your campus, be a part of your campus, do the push-in model, at least give it a try. I don't think you have to do it as the only thing, or maybe if it doesn't work for you, but yeah, I would say get in there and interact with your teachers. And it's great, all the collaboration over the years, because you develop friends. I've been at my campus, 21 years now, and I have friends there on the campus, and so it makes your life much better. Of course, people are going to be in and out there, but yeah, just involve yourself as much as you can. And keep the things functional, realistic, and really just respecting those students, and really treating them as the future citizens that they are, that we want to create for our community, for our world.
Oh, that was beautiful. I was going to make a joke.
Well, and one quick thing I'm going to throw out there, because I want to make sure to kind of get this in there, is seeing how, we all love language, right? We got into this and we love language and everything. So, but so it can be hard for us to understand that sometimes that the students who do struggle with language have so many other strengths.
Yes.
And we have to really be aware of those. And I know it hit me early in my career, because I had a student who really didn't want to come to speech ever. And it was not great, and we weren't close or anything. It was kind of a tough getting him in there, and we worked on the goals and we did all that stuff. But when he left, I happened to pull over into a service station. I can't remember. I think there was something wrong with my car. And he hopped out because it was his dad's place or whatever. And he was a completely different person. This was only like a year later after graduating. But he was so different because of what he knew with his hands and how he could work with the car. And he's a genius level at that, right? So that missing, making sure we see that whole person. We're so focused on language and we love language, but and we want to help people with that area, but that's just a piece of the puzzle, right? Piece of the whole person. And we want to respect that and make sure that we're aware of that and really just guiding that too and keeping that available. A student might just love guitar class, and that might be where they really shine, or their sports or whatever it is.
And so incorporating, really, I think you are hitting it, that it working on the communication should be focused on where they're going and what they want to do.
Yeah, exactly. And again, just trying to get that spark, because we love communicating,
Yeah, we
but
do.
making them feel like they can be good at it and they can enjoy it and should enjoy it. And it's just something good in a positive way, because communication is so important. It's such a fundamental human right.
I love that. A fundamental human right. Did we all hear that? And I know we live it, but I just wanted to shout it out for those in the back.
I think that's Asha's wording, isn't it? What did they say? What's the Asha? I think I stole that from Asha, probably.
Oh, that's right. Oh my goodness, you're right. But no, yeah, it is, that's what they said. I wish I could pull it out and be an amazing hero right now. But
And don't forget, now that we're talking Asha, and I don't want to get into anything about whether these things, what you want to do with your own national association or anything, but I do want to pitch, being involved with your state association or your national association or any kind of thing like that, because that's been a big part of my life and a big part of my career. And it really makes you, and if you're in a district that's maybe smaller or you're more isolated, it gives you that whole ability to connect with so many people in your area or your state or the
so
whole
you don't
country.
feel alone.
Exactly.
And really make sure that the work, I mean, when we're working in high schools, I mean, we are doing the hard job. I mean, these are not easy. This is not an easy population. It is an easy I mean, sorry,
Yeah.
it's not that it's not easy, but I mean, like, it is a huge, when you think about, it's not the end of the line for these kids.
Yeah, and
This is the bridge.
there's a lot that comes up in the high school that you're not going to get. I mean, you have some life situations, and of course they're into
Yes,
drugs and homelessness and what goes on with their parents and violence and
real
all kinds of
life,
things. Yeah,
real
it's real life.
life. And for us to arm them with the communication skills in order to navigate all of these roads and all of these real life things that are happening. So I guess I'm going to go back to, when you're thinking about your goals, think about, is this functional for them? What are they dealing with? What will they be dealing with? Right?
Exactly. Yeah.
Oh my
And what their
goodness.
future careers are and wherever they end up. But they're all going to get, I mean, you just want them all to be successful. And I think the vast majority of the students, they're going to be, right. I mean, it's going to be a
Yes.
challenge. It's going to be a challenge, but we're a piece of that. I mean, and there's a lot of the gains you're not going to see because they're not there anymore. They're off living their lives. But you just kind of hope you had a little role, a tiny little piece of that one day maybe they advocate a little bit more, they communicate, they didn't feel bad. I mean, really, yeah, that whole idea for me, it's just it hits me pretty hard when I think of even the younger kids. I think for all of us, but just the idea that someone would at a certain stage in their life feel that, communication is just not for me. It's not a strength. I'm going to do other things. And that's sad for all of us because we love communicating. So yeah, it's such an amazing profession. Everybody here listening today, if you're an SLP or want to be an SLP or whatever, and there's a lot of stuff lately on social media or now in the last couple of years where people will badmouth the profession or whatever. I never understood that. To me, as a career changer, it's been a great career. It's the greatest
I
thing I've
love
ever
it.
found. It's an amazing career.
I could not imagine not doing this. I honestly feel, and I've been really lucky because I started out as a teacher and then became a speech path. I've worked in all the populations and I absolutely love it.
Yeah.
And
You're solving
so
problems all day long. You're solving problems and helping
yes,
people communicate and being part of their lives. And it's just all great stuff.
I consider myself a puzzler. Like I love that part. When you said like asking the kids what they want to be when they grow up, and right, I remember my mom tells the story that when I was a little girl, Carolyn, they asked me what I wanted to be, and all I said is, I don't know. I just want to know everything there is to know about one thing. And if you look at what I do now as an SLP, that's exactly what I'm doing. I'm a speech language pathologist that specializes in dysphagia in the school setting.
Yeah.
And I am a specialist in that one thing. And so I did it. I
That's
love
it. And
it.
it ties into that idea of you ask them, why do you like that idea for a job? And what is it about it? Because we have more
Yes.
knowledge about how the world works. So we can kind of guide them a bit on that of like, hey, have you ever thought about doing this? Because they actually do this and that. And sometimes they don't always know what these careers entail. So
But
there's a
find
lot
out
of
what their
education.
strengths are so you can
Yeah.
give them ideas for that. Anyway, I know we could probably keep talking and go down other avenues, which we
Season
will.
5, we got to do season 5.
Season 5, guys. Yes. But Bob, thank you so much for being our first episode of season 4 hero. I want to thank you so much for being here. You're always amazing. I love talking to you. I want to thank all of our listeners. You guys are the heroes helping navigate our teenagers through the messiest, probably unpredictable stage of their life, right? Now, if you guys love this episode like I did, check out Speech Therapy PD, but check out some more of my episodes. I am fun. We do some that are practical, really nerdy even. I love it. So if you like School of Speech, please leave a review, a like, share it with your fellow SLPs. Let them know that I'm out here and here we are. And don't forget, if you're listening live and you need live CEUs, please make sure to go to your Speech Therapy PD today in order to get live CEUs. And if you and you can still get your get CEUs even if you don't need them live through Speech Therapy PD. All right. I want to say thank you, Bob, again. Thank you, all the listeners. We had a great turnout. I really cannot wait to hang out with you again, Bob. And I also
Yeah,
can't
it was
wait
great. So great seeing you in DC there in November. We had a great time hanging out at the Speech Therapy PD booth there for a
I
while.
know, it was so much fun. All right, I want everybody that can join us on the next episode. I can't wait to hang out with everybody again. This is School of Speech, y'all. All right, bye, everyone. Stay awesome.